Hi, my name's Hayley and this is Susan. Welcome to Cancer Research Demystified. This episode is going to be about ethics and it's going to be about consent procedures, things we need for cancer research.
Right, so one thing that cancer researchers like us actually spend a lot of our time doing is preparing different types of documentation for ethics committees. And that's because all research has to be thoroughly ethically approved before it can begin. And that's any research including things like getting a blood sample from a cancer patient.
Are on these ethics committees. Depending on what you're doing and where you're from is depending on who you'll apply for. So in the UK you might apply to a local committee, so it might be members of your university or your hospital, senior members of staff, on a little committee who will sort of judge your project and give you the go-ahead. For bigger projects though, often they're national committees, they have patients on them, they'll have representatives from the big cancer charities on, as well as the scientists and the clinicians.
So the purpose of these procedures is to ensure that the best interest of the patient is looked after, that everything is above board and that the patients are made fully aware of what they're getting themselves into.
So an ethics proposal can be anything from a few pages to a few hundred pages, again depending on the scale of the project you're doing. But it'll always include things like what will happen to the patient, how will it affect them. It'll include, are there any samples being taken, and if so, what samples, how long are we going to have them for, what are we going to do with them, and how are we going to store them, and what's going to happen to them, how do they get disposed in the end.
So this usually goes back and forth for a few weeks or months between all the different scientists and medics that are involved in the proposal. It then gets submitted to the ethics committee and they'll have a hearing to discuss the contents of the proposal. If they suggest any amendments, then it goes back to the researchers to prepare those, resubmit them, and everything must be fully signed off before any research can begin.
Another part of the ethics application is to draft all of the letters that you'll get, all the consent forms and all the information sheets. And this is actually normally quite a big part of the application because it's very important that any patient who is interested in taking part, they get all of the information they need, everything they need to make an informed consent.
If you're interested in taking part in research, either a clinical study or a clinical trial, the team will make sure that you read the information sheets and consent forms fully. We need to make sure that you fully understand what you're getting yourself involved in, otherwise it just wouldn't be ethical to proceed.
Some of the things that some patients might want to think twice about are consent issues involving, do we keep the tissue after the trial? If so, can it be used in other ethically approved trials? They also might want to consider whether that data does get fed back to them or not. And these are very personal decisions and each patient will have different opinions on them and can consent differently but both still be involved in the trial.
Once everything has been fully ethically approved, some samples may be collected and stored at a research facility. That's where a human tissue coordinator comes in, and luckily we can talk to one now because Hayley actually provides that role for our department.
So my job is to ensure that every single piece of human tissue we have within our department can be tracked. I need to be able to approach any member of our staff and be able to go, that piece of tissue, what ethics covers that? Where's the consent forms? Are you allowed to do what you can do with that, and do you know what you can do with that? This includes tissue we get from other departments, sent to other departments. It depends. I need to track how much we have, how much we've disposed.
You may be aware of some scandals surrounding the use of human tissue that wasn't properly ethically approved or consented, and although most of those happened decades ago, we do still get some patients that are genuinely really concerned about them, and that's why we kind of wanted to make this video, to give you a bit more information, to let you know how rigorous everything is right now. There's so much documentation surrounding this, just to make sure that everything is fully ethically approved, fully consented, and above board for all cancer research nowadays.
So all that careful documentation and consideration of what we're doing with the ethics actually takes up quite a lot of our time. And as it should, it's the right thing to be. So if you have any questions regarding this, there's a comment section, or any questions in general, just let us know. And thanks for listening. See you again soon.